So can you spot the surgery? Well, most people can't. That's exactly the point.
Hi, I'm Dr. Christopher Zoumalan, a board-certified oculoplastic surgeon and also the creator of the natural-looking blepharoplasty technique.
If you wake up looking exhausted, even though you've had 8 hours of sleep, well, your eyelids may be a culprit. Today, I'm pulling back the curtain on a very specific surgery that I do. It's the male blepharoplasty surgery. 40 to 50% of my practice consists of men that desire to have eyelid surgery. When it comes to addressing male eyelid and brow lift surgery, the goals are completely different than the female patient that comes and sees me. And it's important for my male patients to know that my mission statement when it comes to male blepharoplasty and brow lift surgery is to instill a natural look, a look that no one will know that you've had rejuvenated, one that maintains your masculinity. So stick around, I'll reveal what keeps your eyes from looking overdone. So why do men need a different approach than women? Men's brows generally sit lower than female brows. The lateral part of the brows generally become more descended in men than in women. In female brows, generally you see a lower drop in the entire brow. The shape changes more from the medial, central, and lateral, but the male aging usually presents itself with more of a lateral brow hooding. Generally, about 25% thicker skin are seen in men than women. And also, the structures are just heavier. There are more fat prolapse, for instance. There's just thicker structures in that are occurring with the aging process. So these are all important things to take in mind. And also it's important to know men don't want a dramatic look to be done. They want a very natural look to be done. So when it comes to evaluating my patients, I'll first establish in the consultation the changes that I'm seeing from the forehead, eyebrow, upper lid, all the way down to the lower lid and the mid-face area. I don't like to perform endoscopic brow lifts when it comes to my male patients. Endoscopic brow lifts in general tend to create more of an improvement in the shape of the entire brow, and that look tends to be a little bit more overdone or perhaps more feminized in my male patients. There are exceptions, but generally speaking, since men generally have a high hairline like I do myself, I'm not a good candidate for an endoscopic brow lift. The incisions are going to be made way too high up, and my frontalis muscles are so strong that even after I'm having the surgery performed, the long-lasting results may come into question because of my very prominent muscles. I find a direct lateral brow lift to be a very optimal procedure for my male patients that have low-set brows. It's a small incision that I make on the lateral tail of the brow, above the hairline. A small strip of skin is removed, and then very carefully closed. That lift is done in a very natural way to address that tail of the brow that's dropped. And one, addressing the issue that my male patient has, but also instilling an improvement that's still masculine. And I love this procedure. It heals incredibly well with the way that I close with very specialized sutures that create an eversion, where the wound is everted, and I'm carefully able to apply those sutures so that wound heals perfectly well in the recovery phase. Once I've achieved the outcome I want with a lateral brow lift in those particular patients, they do have a brow lift issue or they do have hooding in their brows, I can then look into addressing their upper eyelids. Most of my patients that come and see me for rejuvenation around their eyes will undergo an upper and or lower lid blepharoplasty. Not all my patients will need a direct lateral brow lift, but the ones that do need a lateral brow lift usually will then end up undergoing upper lid blepharoplasty as well. So then that procedure itself, whether it's done alone or with a combination of the direct lateral brow lift, I make my incisions very carefully through my patient's natural creases, so I do not create an artificially different crease. So the natural crease, so when it heals within your own natural fold. And the way I do this procedure is I make sure that that crease is not visible because the surrounding structures are still allowing that skin fold to lay on top of that crease. So I'm creating a nice aperture for the eyelid, but the skin fold above still hides that crease as it heals. So it's imperceptible even during the healing phase. It's normal for that incision to be a little bit red and raised and thickened during the healing process. But generally that gets better over the first few weeks, first few months. I always recommend Skin Scar Cream, which is a product that I've developed, invented, and clinically studied to allow my patients to use that product to allow for that incision to heal as well as possible during the healing phase. Let's talk about the lower lids. So generally speaking, patients will come to me and also notice that their lower lids are making them look tired. It's maybe their upper lids, but it's really their lower lids. You see that presentation, they have very prominent fat pockets in their lower eyelids. This is a very common condition that I see in my patients. It happens with aging, it can be genetic, it can be lifestyle. So these fat pockets become more prominent. And generally this has nothing to do with weight gain or weight loss. If you end up gaining more weight, your fat pockets generally around your lower lids do not change based on weight gain or weight loss. It's important to know that. But a lower lid blepharoplasty in my male patients can take my patients look to about 10, 15 years younger than they were before they had these fat pockets that were prolapsed. The way I perform this procedure is through my natural looking blepharoplasty procedure. This is a procedure that I perform mainly with an incision that I make from behind the eyelid. It's called a transconjunctival approach, so the incision is not visible as it heals. I identify these fat pockets very carefully. There's usually 3 fat pockets that are prominent and prolapsed: the medial, the central, and the lateral. So in my male patients, it's important for me not to over-sculpt. It's important not to over-remove these fat pockets, but to really utilize these fat pockets and to reposition them into the areas that really need that volume, which is the infraorbital rim hollowing. So fat repositioning is a big staple to my male patients when it comes to rejuvenating their lower eyelids. And then, what do I do with the excess skin? Does the patient truly have extra skin, or is it more just skin crepiness and wrinkles that are present, or it's a combination of both? And that's where either a chemical peel, a CO2 laser, microneedling may be an option to improve the skin texture, but perhaps a skin pinch will also be needed to address that excess skin. That incision is made very carefully below the lashes. It's called a subciliary incision. It heals incredibly well the way I place it just below the eyelashes. So when it heals like a little wrinkle just below the lashes. But that allows for me to also reduce the excess skin. In those particular cases though, I will always suspend the lid to make sure the lid doesn't drop or change shape during surgery by just keeping it nice and tight with a small little suture that I place in the corner of the lids. And we'll talk to you more about that as well. It's called a cantopexy suture, which I like to use and integrate to allow for my patients to still allow that lid to heal well during the postoperative phase. What I suggest is get a mirror, look at yourself, have your chin down, and while you're looking at the mirror, so your eyes are in a slight upgaze position. And that way, when you're looking in the mirror, you're really accentuating and visualizing the amount of fat prolapse that you have, and also degree of hollowing that you have. And that gives you an idea, if the fat pockets are present, whether you have hollowing as well or not. And that will help us guide you toward a path of rejuvenating your lower eyelids. Now, when it comes to the upper eyelids and the brows, what I love my patients to do, which I do in my office, is have my patients relax their forehead, just not raising their forehead, but just relaxing it in normal resting phase, and then opening their eyes, looking at the mirror. And that way, you're getting to appreciate how much brow descent there is, how much extra skin there is. And that helps you get a better picture of whether an upper lid blepharoplasty will help, or whether a brow lift combination will help. There are a lot of patients that have such significant changing in their upper eyelids that their peripheral vision may actually be affected, and they don't even know that, because the brow situation is causing so much descent laterally that's blocking some of the peripheral vision. And an added benefit of the surgery is to improve your peripheral vision as well in those cases that there is some significant skin and brow tissue that's essentially hooded over your eyelashes. So check any one of these items and you see an issue, well then you probably will be a candidate for either an upper or lower lid blepharoplasty with or without a brow lid. So how do you customize it? Is it just the same thing for everybody? Is it a cookie cutter procedure? I like to think of it as bespoke tailoring. When I'm doing my work, I'm using my delicate measurements, my expertise as an oculoplastic surgeon, and your older photos when you were younger to get an idea of how things have changed and what I can do in a very beautiful and delicate fashion to rejuvenate your eyes. So I use fine marking pens, fine rulers to make my measurements based on what I want to improve in your upper and lower lids. And that allows for me to carefully create a result that's beautiful, natural, and takes you back many, many years. I mark and measure at least 3 times, sitting up, standing down, and often during a surgery, I may even bring you up to get the right exact results that I need. Mapping eyelid to eyelash distance, measuring the amount of skin I'm removing perhaps in the lower lid for a skin pinch, evaluating the exact amount of fat that I'm removing in the lower lids, and then measuring the amount of fat that I'm repositioning to fill in the underlying hollows. If I'm doing fat grafting at the same time to improve some of the volume loss here in midface, assessing the degree of volume loss you have in a volumetric fashion to then improve that with fat grafting is all done lying flat, relaxed, sedated under my OR lights. And when it comes to marking, I redraw until it just comes natural to your face. Remember to know that 1 millimeter at a time shows off forever. Will I have visible scars? Not if it's done right. The incision hides within your natural crease. So when all is said and done with the healing process, the skin above creates that fold, so that incision is well hidden during the whole healing process. It usually takes a few months for the incision to completely heal to a point that you'll be satisfied, but just know that it takes a process, and usually the redness, the thickness of those little bumps that you see are completely normal. The pigmentation that you see that may be a little bit dark along some parts of the scar, completely normal. Ultimately, the goal is to make that incision flat, and the redness will go away along with hyperpigmentation. Does it hurt? What anesthesia do you use? Eyelid surgery is not a painful procedure. In fact, most patients just say that first day can create a little bit of tightness for them, a little bit of discomfort, a little bit of achiness. But severe sharp pain is not something I normally hear. Usually this discomfort lasts for a day or so. That tightness can last for a few days as everything settles down. Generally, most of my patients do quite well after surgery with just the use of icing, ice compresses to help the area that I've operated on. Generally, we do about icing 20 minutes on, 20 minutes off for the first few days. And then rarely do my patients use anything besides extra strength Tylenol for pain, but we do have extra pain medications if need be. But again, it's not something that I generally expect my patients to be taking besides the day one. So a great surgery, great recovery, and a very overall positive experience I get from most of my patients, if not all. How long will the results last? Anywhere from 10 to 15 years, depending on how you take care of your body, how you respect your body, your medical conditions. And generally speaking, if you're healthy, you're not a smoker, you're not a big drinker, you respect your body, you use a lot of sunscreen when you go outside, and occasionally do some Botox and some skincare treatments on yourself, you should do very well for a long period of time. And what are the risks? Generally, some bruising and swelling is expected in most of my patients. Usually that gets better within the first 2 weeks. A little bit of dry eyes is usually seen in my patients within the first week or so. Some tearing, some irritation in the eyes, normal. Some blurry vision can happen as well with the use of the ointment that we're placing. It sometimes goes in the eyes. These are all temporary, transient things. They all usually get better within the first week, 2 weeks or so. And very rare to have severe complications from this procedure. Otherwise, it wouldn't be as common as a procedure as it is. There's always risks and complications that can occur with any surgery, but the importance here is to go with a surgeon that's an expert in cosmetic eyelid surgery, one that is boarded in oculoplastic surgery, one that devotes their whole career to this particular sort of procedure, and one that you like seeing their before and after results, one that you like to see how the results are and if they fit in your mindset of a natural look that you'd like to see in your eyes. You got another question that I missed, please drop it below and I'll answer it personally. If this helped, hit like so more guys can subscribe and get more info when it comes to their eyelids.